And we can go ahead and get started.
All right, I'd like to thank everyone for joining us today on this special version of Project Echo. Today, we are going to be visiting with Dr. Jerica Wesley. Dr. Wesley is a recent graduate of counseling, education, and supervision from Ohio University. And she has her master's and bachelor's from Marshall University. She works here in the Charleston area. I know she has worked with Keep Your Faith Corporation. She's also assistant professor up at Marshall University. And Dr. Wesley works here in our community locally and tries to educate us on how we can do better in our clinical services in the county. And with no further ado, I'm going to introduce here's Dr. Wesley, and she's going to fill us in today on what we are going to learn.
Well, good afternoon, everyone. I'm seeing some hands. I'm loving this. I do not take it for granted that you all are here this afternoon in Charleston. It's a beautiful rainy day, and I know that Zoom fatigue is a whole thing, and for you to hop on this afternoon means a whole lot. So thank you, Mr. Craighead, for sharing a little bit about me, and especially thank you to Project Echo for this opportunity to connect with all of you all today. So I'm going to try and see if technology is on my side to share. We're going to see, because
you should have full permissions to share.
Okay. Let me get the right screen up here. Okay. Oh no. It's moving too quickly for me. Okay, there we go. Can you all see my screen? All right, perfect. Let's see here. All right, so let's dive in for today. So again, I'm Jerica Wesley, very joyed and overjoyed to be here with you today. I have not had my coffee, so send me some good vibes over here. Caffeine is certainly my friend, but I'm so excited to be able to talk to you today, just in terms of maintaining and making sure that we have tools to maintain for this never-ending pandemic, $15 gas prices, lack of formula. It's hot, it rains every 5 seconds here. There's just been a sense the last 2.5 years that we don't have any relief. And so my hope today is that after our time, we'll have some better tools and some other ideas to get kind of reacquainted with wellness and apply them in our lives, and even to recognize and be supportive of others as they navigate kind of their continuum. So I'll welcome you today. And I just have 3 goals today. Let me minimize this. I want us to be able to describe some positive coping practices, identify community resources to support emotional wellness, and define the window of tolerance. And as I go through, if I have some time at the end for any questions or comments, but feel free to chime in as we go along today, okay? And so we've got to start with the fun stuff. We've got to address the elephant in the room, which is stress. And with that in mind, you know, we all have mental health. And sometimes we may think, oh, mental health might be for a certain particular population of folks, or folks with a certain kind of experience. In reality, we all have mental health, and it's something that should be on our mind and on our radar on a daily basis to kind of assess how we're doing, because our needs change every day. I would even say every hour with some of the things that we go through and we experience. So looking along this continuum here, maybe take kind of a personal assessment of where you are, and you don't have to answer out loud or include it in the chat, but think, looking at this continuum, am I a place where I may be in crisis? I might need a lot more of different supports involved in order to tend to my needs. Am I in a place where I'm kind of struggling? I might be tired, or I have some poor sleep and nutrition kind of things going on, or I'm in a place, am I kind of on autopilot? Am I surviving? Do I feel worried, irritable, distracted, or withdrawn? Maybe there might be some Zoom fatigue in surviving. Or am I thriving? I'm in a place where I feel pretty confident. I'm sleeping well, I'm maintaining, I'm adjusting. There's some normal social activities involved. Or am I excelling? I'm in a place where I'm feeling and I'm realizing my potential. I'm in my normal flow. So just kind of take a moment to assess where you, may be on that continuum. Because what we know is that stress is not just kind of an experience that's related within our mind. There are some physical and mental implications of stress. And you may have noticed, these last couple of years, and it's so weird saying years, but it's been years as we've navigated this, in terms of our body, we might have increased headaches. We might have more muscle tension or pain as it relates to being brought on by stress. It could be increased fatigue or sleep problems, or even an upset stomach. Those are some things that kind of can be triggered in our body by stress. In terms of our mood, my goodness, there could be an increase in anxiety, restlessness, feeling overwhelmed, feeling just a sense of being out of control, because in a sense of like decision paralysis. We're always trying to make these split decisions, trying to move throughout our day and make the best possible situation or decision possible as we're going through. There could be some sadness or depression, and all these things could be connected to stress. And certainly on our behavior, our tolerance might be a lot different. We could be having some outbursts that aren't maybe typical in our character. We may notice those in others. There might be this sense on overeating or undereating. With the things that we've been going through, my goodness, food has kind of been one of the things that we can control. It could be drug or alcohol use, tobacco use, and it could be social withdrawal as well, and even exercising less often. So those are a few things, not all, but how stress can really impact our body, our mind, and our behavior. But there are some things that we can do about that. So, and we're going to walk through this and hopefully build on some practices and get you reacquainted with some things that were previously in place. But what we know, there are maladaptive coping practices, and there are also adaptive coping practices. So of course, with maladaptive, that means, stress is delayed and grows in intensity. So it's coping that is tabling the stress or stressor. So it's not necessarily going through or processing what's going on, but it's just kind of tabling it. It's just leaving it there, and leaving it there has the, potential for it to grow. Versus adaptive, which is when stress is realistically evaluated and resolution is sought. So I'm gonna, let me see here if I can be technology savvy, because I want to see you guys. In terms of the stress and different things that we've been navigating these last few years, have there anything in terms of an adaptive or a maladaptive that you maybe have seen going on? Anybody care to report out on just some things that you've noticed in terms of how folks have been coping during this time?
Hi, it's Dr. Jeffrey. I will tell you one thing. I have never seen so much anxiety in kids of all ages. And kids don't say anxiety, right? The way they will express that they're having anxiety is typically that unsettled feeling and irritability. And I've had so many parents say, I don't know what's happened to my loving child. Just yesterday, I had one mom who said, is it because he's 14? He has been such a sweet child his whole life. I had older sisters I dealt with, and I just always said he was such my blessing. And then, and it's like a brick hit him in the head. Like I think he's had a concussion and I'm not aware of it, because all of a sudden he is so irritable. He's talking back, and I've never had that happen. So I'm just hearing that so much from my parents, and they're at their wits' end, and it's really, really hard to fit that in with everything else that we're discussing. So I so appreciate this talk.
Oh, absolutely. And I appreciate you chiming in. And to think too that everyone experiences stress differently, right? And in kids, you're absolutely right. It may come back in just intolerance and outbursts, and where some folks might think, oh my gosh, there's just these extreme behavioral episodes, and they could just be overwhelmed with anxiety and just the inconsistency in things. Children weren't able to connect for a while. Children weren't able to go to practice and have the outlets that they were, once able to. So although, we've got to think about the little people too. Absolutely. So I think I saw, was it Miss Burrell?
Yes.
Yes, ma'am.
Can you hear me?
Yes, ma'am.
Whoops. I don't know what's happening here. But anyway, I was thinking, as we look back at the first of all, everything was upended with COVID. And so suddenly children no longer had the friends that they saw every day. They no longer had that daily routine. And it's difficult with children and their health, and especially in terms of childhood obesity, to think about how entwined stress and diet and wanting to do anything, not wanting to move, not wanting to interact, not wanting to do anything good for our bodies. It's difficult for adults. So how much more difficult is it for children? And it's going to take, I believe it's going to take us a while to get back to where we were prior to COVID, but we will get there.
Absolutely. Absolutely. Just the jolt of, I think we all can recall probably where we were in March 2020, when it was like, hey guys, we're going to shut down the world just for 2 weeks though, just for 2 weeks. And just the weight of that and how it felt for us. And then for children, it's like, oh my goodness, so I'm not going to see my friends. We got a good idea of how important school was, even though there's kids who complain about going to school, right? Because who wants to wake up early? But we see that it's not just about academics. It's a lot of social and emotional things that are established at school. And so I'm glad it seems that we're getting to a point where we're making some transitions. But I think you're exactly right. It's going to take us some time to get back to where we were. And it's going to take conversations and collaborations in order to see that come to pass.
I would also like to chime in on what Ms. Burrell said in terms of health. Yeah, because we were sitting at home and we were not active. And though, and it does affect children, adults eating constantly, and children see this. Children see adults eating, and that's comfort food, and it's just passed on to the kids as well. So anytime there's stress, we pass these things on to our children in terms of how we eat and how we cope with stress. So we as adults need to maybe learn how to do better, so that our kids will learn how to cope with stress a little bit better, as opposed to turning to food. We can turn to something else, maybe jump rope or walk or something in those terms. And I agree with Ms. Burrell on it. It's going to take some time for us to get back to some type of normal in this day and age, because it doesn't look like COVID is just going to go away. And we're having new variants every month just about, and this variant was worse than the last one, and so it's always a stressor. And they even though they say they will never shut it down again like that, we don't know what they're going to do. But we do need to learn how to cope with our stress in this time, in this society at this point in time.
Absolutely. Yes.
Oh, sorry.
Yes, please.
I can also share kind of a sad episode that I witnessed at my church. A child who, and Dr. Jeffries, I'm sure you've seen this many times, a 7-year-old who was overweight, who is very overweight, and her mother is fussing at her at church about her weight. And I'm thinking, this is a 7-year-old. She's in your home. You are responsible for what she's exposed to, for what she eats, for how much television time she has. You are responsible for all that. But in her own sense of frustration, not wanting to deal with, I'm sure, maybe what she felt was a failure on her part, she's taking it out on the child. And all of these types of episodes have been increased since, in the last 2 or 3 years, because all our normal routine was upended. But it was extremely sad to see. And I'm curious as to how you deal with parents when they want to put the responsibility on the child.
Excellent point and excellent question. And I begin to think of, I'm always full of quotes, and I might be a little corny, so you'll have to forgive me, but I always go back to being on the airplane and how they always say you need to secure your mask first. And so it's important for us to recognize what our needs are. It's important to realize the exposure and the influence of the power of our influence as parents and as providers. If we're constantly sharing, okay, listen, Jerica, I see that you're not active and you're just eating a row of Oreos. But what's been modeled there? So it could be, all right, I see that there are some concerns here. How can we best support the family? And maybe looking at some different ways. Because children are sponges, and so more is caught than taught, right? So it's a whole thing of how can we gently restore wellness and balance and some self-reflection so that we can move forward in wellness. And sometimes that hurts. I need to make some adjustments. I need to make some changes. I'm an adult. It's some self-reflection, I believe. I think that's where we start to support the family. Yeah. So let's see if I can be technology savvy again and reshare my screen. Hold my breath every second. But just in our conversation, and please chime in at any point, we talked about some maladaptive practices in our conversation, and how eating is potentially one of those sources of comfort that many can rely on. And honestly, it was probably one of the only things that we could do when everything shut down. So looking a little deeper here in terms of adaptive and maladaptive. Making that shift to adaptive can be a very difficult one and involves us to engage in some active problem solving and reaching out for support. So it may mean if we're working with someone, I hear you talking about, different practices in nutrition. I have, a great resource in so-and-so that can help with this, or give you some resources, or even as a website, a handout, any of those things to get folks engaged and thinking outside of the problem, thinking towards solutions, and even changing our expectations. It may not be okay. So I know that we're thinking about supporting our children and making some adjustments, and we're going to go on a family walk every day, even when it's raining and there's a tornado. So it might be we change our expectations, and maybe we do something as a family once a week. And it might not even be the language of we're going to work out. We're just going to have some family time at the park, So adjusting and changing and even challenging some of the expectations that we put on ourselves in order to that emotional piece, to regulate emotions, because we all have emotions and they're signals to us, and we need to be in tune with what they're telling us. And we also, on the behavioral piece, taking actions to reduce stress, I begin to think about how we can reinforce our boundaries and changing how we think about the stressor. Because what we don't want to happen or have happen, I've heard so many different reports, about how through COVID, our physical health has really declined in terms of folks not reaching out for support, in terms of not maintaining medical appointments. There's just so many different things that this has compounded. So we've really got to think of how can we shift toward wellness, and how can we support? Did I have a question or a comment? I hear something. Okay. So we've got to make that shift here. And I'm really curious, what do folks know about the window of tolerance? Oh, so this is exciting. So the window of tolerance is essentially how I live my life. The window of tolerance it was developed by Dr. Dan Siegel, and it's kind of a tool that we can use to navigate where we are, and we can recognize where other people are. So the window of tolerance, where we are here, I wish I was right there in that window at the beach. Maybe it's Hawaii, maybe. But this is where we want to be. This is where things feel just right, where we're best able to cope with the punches of life that are constantly being thrown at us. We're calm, but we're not tired. We're alert, but we're not anxious. Within the window of tolerance, I know, there's the expression like fight, flight, freeze, and fawn. And this kind of puts it into perspective for me. So looking kind of on this left-hand side, as we think about the window of tolerance, it's very flexible. When stress and trauma shrink your window of tolerance, it does not take a lot to throw you off balance, okay? And on the other hand, working with a practitioner can help you to expand your window of tolerance so you're more able to cope and manage with challenges. Because if we're on either extreme, on the very top, we're overwhelmed, we're out of control. It's not something that you choose. And that's what I really appreciate about the window of tolerance in the model. It's not something that we choose, it's something that takes over. This is where we can get into, folks are having some anxiety attacks. This is where folks are just feeling totally out of control, anxious, and intolerant, right? And we've been there. We're all human. We've all been there at some point in our life. And on the other side of that, with hypoarousal, that's the point where we're kind of zoned out. We are withdrawing, we're overwhelmed, and our body just essentially shuts down. So managing in that middle space is where we're wanting to stay. And to look at it like this, in terms of the flight, fright, all the F's, the flight, fight, and then freeze. We've got to strike a balance with where we are as providers. Where are we when we're connecting with those that we serve? What can we do to extend our window of tolerance so that we can maybe be a better support to ourselves and those, that we have the ability to serve? So just looking at it this way, and to me, it helps to put things in perspective and extend myself some grace and also extend grace to others. But I'm really curious, what are your thoughts of the window of tolerance? Is this something that you've seen, or what are your thoughts about it?
This is Susie. I haven't seen that terminology before, but I really like it and can appreciate the concept. It's like my grandmother used to say, when you have a certain level of stress, you're like a pot already simmering, and you're not in that window of tolerance, and it doesn't take much to set you over the edge. Sandy and I just participated in a educational experience from WV School of Nursing yesterday that was about veterans coping and the high rate of suicide. And that was one of the concepts that they were trying to instill in the nurses on the training, is that, there's always things simmering no matter what else is going on in their life, just from the past experiences.
Excellent point. Absolutely. And I always appreciate the visual things. You said what your grandma shared. I often think of a Coke bottle, we're shaking up, and when are we going to explode? When we're in that red zone, that high intolerant stage. So, what can we do to allow those bubbles to settle, right? So I so appreciate that. And I hope this is something that you all can kind of think on. I'll be happy to share this with you all, the PowerPoint with you all. Let's see. Any others care to chime in on anything?
So this might be calling myself out a little bit. So when I was looking at the very colorful visual of each zone of the window, I'm assuming, so I had a question in the chat of how do you really know when you're fine. Of really, how do you know when you're in that good zone of, in my brain, I'm like, I can't settle unless I reach a milestone. I can't be happy about something unless I hit a milestone. So is it more of a state of mind of just trying to be at peace with yourself? Or is it you accomplish something, you feel good, you feel like you're in a right spot in your life kind of thing? Or is it a little bit of a mix?
I think it's a little bit of a mix. I know that we definitely get those good, those hormones when we complete things, when we do things that are personally satisfying to us. I think it's when those accomplishments can potentially turn into more stressful things, then it can take us on either extreme as we're navigating those.
Right. That makes sense.
Sure. Thank you, Lakin.
And then, I always have to chime in. I love the simmering pot, Susie. What I use with my younger patients as a visual is a volcano. And that the volcano always has lava in it, right? But it's boiling down here below. And I try to teach them to feel when the lava is getting up, so we can keep it down, so that when any little thing happens, they don't erupt. I just wish I could use that for myself.
Don't we all?
I would take my own advice.
I totally understand. And that's why, I often think of, Jerica, put your oxygen mask on first. the more experiences that I have with things, the more challenging it is. You know, yes, I am a whole clinician, and my goal is to empower folks and to teach various skills and practices to move them on in their journey. But my goodness, if I don't have the ability to consider where I'm at, then I'm not going to be very valuable to them. And so that might mean that I might take a day off, and that sounds wrong. That sounds so counterproductive. Or it might mean I chose to do Mondays because Mondays, I had someone who referred to Sundays as the Sunday scaries because nobody likes Monday. So choosing something on Monday that is restorative and good for you, whatever it is, just to kind of shift that mindset. So that may have been a ramble, but that was just me talking about how I try to check myself and put my oxygen mask on first. So let's see here. Oh, was there someone else? Let's see here. Back to sharing. So this is, again, just another display of the window of tolerance, and I'm happy to share this with you. I really like Blessing Manifesting. She's all over social media and puts out really great content on various mental health topics and things of that nature. So now that we're looking ahead, and it's like, okay, so yes, the Sunday scaries is a thing. How can we begin to transform our practices, and how can we empower others to consider their own wellness journeys? And I really appreciate looking at things from a wellness perspective. It allows us, I believe, to look at a person in a very whole way, because we're not just feelings and emotions. We're connected. We're a whole complicated person who has various identities, right? So emotionally, you know, considering how are we able to cope and create satisfying relationships. And that was something that I feel was such a difficult thing, and still is, as we navigate COVID, hearing that, you know, some folks have been disconnected from their family for, 2 years or longer. That's a very hard thing to consider and even hear. So considering how are we able to engage in satisfying relationships? How are we able to incorporate that into our practice to make sure that that need is being met? And with spiritual wellness, expanding our sense of purpose and meaning in life. And that can mean so many different things, but really considering what that means to you and moving forward with that. Intellectual wellness, I would dare to say that Mr. Craighead could tell us a lot in terms of intellectual wellness. There's just so many things that I think is education is power, right? And education also can allow us not to go so far out in our worry zone. So there's certainly a balance with the information that we receive, but recognizing creative abilities and ways to expand knowledge and skills to continue to stretch yourself and to, I don't know, I'm a lifelong student, so intellectual wellness is fun. Physical wellness, recognizing the need for physical activity, diet, sleep, and nutrition is not one that we can just hit on the burner. We all have physical and mental wellness. We all have these components of ourselves, and we all have varying needs. But how are we showing up for ourselves in the physical wellness world? Are we tending to proper nutrition? Are we drinking water, or are we going to Starbucks every day? And that was specifically for me. So no more Starbucks, but environmental wellness. Somebody chimed in.
No, I'm laughing because I deal with so many people with the wellness programs that I'm putting in Kanawha County, and Starbucks is like it. But I also, I try to make sure that when I'm dealing with adults that they keep in mind that they are a representation for their children, because children are going to mimic whatever you do. They see what you do, they're going to do the exact same thing. and it goes on from generation to generation. And when we say we have diabetes in the family, it's really not that you have diabetes in the family. It's just the fact that you just have bad eating habits that's been passed down. So I agree with you on the keeping the wellness from mental to physical. We do have to be mindful of that, because if you don't take care of your wellness right now, you will be making time for your illness later.
Absolutely. And I think, oftentimes, and please chime in, with kids, with children, with adolescents, it's this idea of, oh, I can table that for now. This physical stuff, I can go and drink all the Mountain Dew, eat all the Papa John's pizza. I can do all these things. But in fact, it's like we've got to assess our habits and what we're exposing our little people to, because they are sponges. And it's like we kind of tearing down that notion that we have to wait until we're older or till we're an adult to care about our health. And I think that's something that we've got to constantly address in our communities. We don't have to wait. We can start drinking water today. we can start, prioritizing ourselves in this way today by doing this. So just subtle things that we can incorporate.
I agree. I've run into so many younger people, young adults in their 20s, late teens. They do think like that. They feel, well, the old thing of, when you get older, you gain weight. As you get older, you gain weight. But it really starts when you're in your childhood, and what your concept of food is, and how you've dealt with food and deal with food, how your parents showed you what food was. So I agree so wholeheartedly with this. Making sure that, kids understand that, no, you don't have to wait till you're 40 years old to actually, I better do something now. Because those Red Bulls, they do have an effect on you. You just don't know it. It may not hit you until you're in your 30s and 40s, but it could affect you real bad. And people don't understand. Even the Starbucks, the amount of sugar that's in Starbucks and one frap is unbelievable. So yeah, we do need to make sure that kids understand that it is very important to start looking at health. At least put the idea in their head. They may not do it right away, but you want to get a hold of it before they get to 30 and 40. Because when you get to 30 and 40, you start feeling them aches and pains, and things change real quick.
Absolutely. So planting seeds.
Planting seeds.
Yes, sir. In terms of just looking at the environmental wellness, what are we doing to support and stimulate our environments? Financial wellness, I feel like that's another one that, maybe some youths might think, I don't have to worry about that till, I'm 30 or 40. And then you're looking at retirement and it's like, I don't know if I can retire. So there's so many different things to think about, and that financial wellness leads to stability, right? So all of these things kind of lead us to stay in that window of tolerance. There's not this idea of we're just going to table intellectual wellness or emotional or spiritual wellness for July. We're going to revisit all these things in October. It's something that's constantly on our radar. And occupational wellness, my goodness. For so many of us, our occupation is an extension of our identity and who we are. And so we want to make sure that we're having some personal satisfaction and enrichment in what we're doing, right? And so in order to be able maybe to keep up with some of the internal goals that we have for our profession, we've got to make sure that we're keeping all these other areas in balance as well with our occupational wellness. And that might even mean setting boundaries. Do the do not disturb on emails, the do not disturb at various times, and considering how that, going to trainings, connecting with colleagues, all of those things are so important. And with social wellness, this is something that we've really done a good job of discussing. I mean, we've seen how things have really shifted as a result of COVID. So really working to restore different parts of connecting. I know for sure we used to do family dinners every month, once a month. And so like considering how we can incorporate that back. How are we developing our support system? What does our support village look like? Do we have, a mentor that we can call on? Do we have close personal relationships? Do we have colleagues that we can confide in when we're navigating different things on the job? So all of these things keep us in line, keep us whole, keep us balanced, keep us in that window of tolerance. And I also wanted to share some resources here. Of course, the National Alliance on Mental Illness, a very respected organization, a grassroots organization for mental health. They have support groups, they have information for adults, information for youth, that you can reach out and see information on. They have various activities and communities to support and bring awareness around mental health. The National Suicide Prevention Lifeline. These are all resources to hold on to and maybe share with others. And I wanted to bring your attention to the bottom left of the screen, 988. The Lifeline just went live a few weeks ago this month. So that's a resource connected to the National Suicide Prevention Lifeline. So in addition to contacting that telephone number, you could also use 988, just like we do 911. I've called, someone addresses your issue right away. So very helpful resource to have. Help for West Virginia is specific, of course, to our state, and you can be connected with different community referrals in terms of addiction and or mental health. So just a few resources here. In addition, there are folks often looking for counselors and therapy. Another resource that I did not include on here is Psychology Today. Psychology Today is essentially like a social media or Facebook or a repository for clinicians, and you can go and you can select things that are important to you, or you can encourage your clients to select things, whether they're interested in finding a provider for themselves, for a youth, whether they're interested in someone who does grief work or trauma work. You can make specifications for a male or a female provider, any of those things that may be important for that particular client. So Psychology Today is another resource that you can share with folks and even use yourself as you consider moving forward in your own wellness. And that's another tool to share with folks as well. And so that's kind of what I had for this afternoon. And here's my information. Please, please, please reach out if I can be of any assistance or further support. But at this point, I will stop sharing, and I certainly welcome any questions, comments, or concerns that you may have. Thank you all for joining. My goodness.
Well, thank you for taking the time out of your day. I know you're busy for doing this.
Well, these conversations are, this is where we start. This is how we continue to keep the momentum going. So happy to anytime. Sure.
Jerica, I'm sorry, I joined a little late. I work at the Medicine Center, and we have a huge need for getting our young kiddos connected with mental health resources. Are you all taking referrals? And do you have age limits that you would see?
Now, are you in the Charleston area?
Yes.
We are accepting referrals. Yes, for sure. I can include, if that's okay, Orlando, I'll
Oh, yeah.
include that information to Keep Your Faith, and some other providers around the Charleston area who support youth as well.
Oh, it'd be great. Thank you.
Of course. I'll make that note to do that. There's Keep Your Faith, there's Mosaic Wellness that I'm familiar with. And there's a few others that I'll be sure to include. Any other questions or comments that I might be able to help with?
Susan, Mosaic does not accept Medicaid.
Thank you.
Okay. Yeah, that's good to know. That's a pretty large proportion of the patients that we treat. So.
Okay, I do know that Keep Your Faith does. I will build some other resources as well.
Thank you.
Of course.
We have any more questions for Dr. Wesley? Well, Dr. Wesley, I do appreciate you taking the time out today, and I thank everybody for joining us here on Project Echo. This is a special event. We'll more than likely have a few other special sessions going along the way for the year. I'd like to thank everyone again for this afternoon, and you all have a great afternoon and great week.
You all take care. Thank you all.
Bye-bye.
Thank you.